Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Academic activities resume in Lagos State University amidst coronavirus pandemic following agreement by Lagos State Government and Joint Action Committee of Staff Unions on the payment of the new minimum wage, among others. Benue State Government cancels third term for non-exit classes, warns schools against charging fee for the term, announces full resumption of schools beginning September 21. And scientists from Uganda's Makerere University and National Army launched study on plasma from recovered coronavirus patients and its effect on positive cases. So we begin with Nigeria's cases, COVID-19. You can see from the COVID-19 case monitoring dashboard, it has an overview of the confirmed cases, the active cases, those that have recovered, and the deaths. New cases were reported from 8 states last night, Lagos leading at 33, and several other states that recorded cases as well include Plateau, Kaduna, Ogun, and the Federal Capital Territory. You can see that our death toll in red there is currently at 1,088. Well, 5 deaths were reported in 24 hours, and they happened in 3 states, Edo, Cross River, and Lagos. Now, if you look at a breakdown of some of the deaths that have been recorded, over 50 recorded in 5 states. Lagos is leading with 205, followed by Edo, the FCT, Rivers, and Kano. They've also recorded over 50 deaths. But as much as we're recording deaths, as much as we're confirming more cases, a number of people are also recovering from COVID-19. And the total figure there is at 44,430. We have a breakdown of some of the states that have discharged patients, and this is in the last 24 hours. 93 were discharged. We have Plateau leading. Plateau discharged 47 persons. Kaduna 21. Ogun has discharged a number of people as well. 17. Edo 7. And Cross River 1. Now, in the meantime, while these are the cases in terms of what we're seeing, we also have those that are on admission, and that points us to our active cases, which is at 10,960. The FCT still has a larger number of persons on admission that it is currently treating. Now, the World Health Organization has said that the tallies probably reflect only a fraction of the actual number. And this is when you look at cases that Nigeria is recording. The continent's case is talking about Africa, and the global numbers that's really had it close to 30 million, while even though 20 million, over 20 million have recovered across the world. But it is saying that many countries are still only testing symptomatic or the most serious cases as of today. But let's leave there and continue with other stories. And this is following the closure of schools across the country due to the coronavirus outbreak. The third phase of the East lockdown has brought about state governments announcing different dates for the reopening of schools. Now, in Lagos, the governor weeks ago had announced the resumption of the state tertiary institutions on the 14th of September. But students and lecturers of the Lagos State University, LASU, were prevented from gaining access after the ASU and other unions locked the gates. Today, an agreement has been reached between the Lagos State Government and the Joint Action Committee of Staff Unions like ASU, SANU, NASU, and NAT on the payment of the new minimum wage. The university campuses are now open for normal and academic and administrative activities, with lectures to begin for final year students on Monday, the 21st of September. Now, the Minister of Labour is insisting that the meeting between the federal government and organised labour made some progress and that the federal government is willing to address some of the issues presented by organised labour. Dr. Chris Ngige mentioned this while briefing State House correspondents after the Federal Executive Council meeting, which held at the State House, Abuja.
We now agreed that all sides should go back to their principal. So the NLC is doing their Central Working Committee today to present this, and if there are other things, we'll follow it from there. Somebody said that the money that have resulted because of PMS increase, transportation and government workers are paying more for transport and the rest of them. Yes, we agree, and when they come back to us, we will know what to do. There was even a proposal there too on the floor that minimum wage is never taxed by previous law. Yes, finance minister will look at it and see whether we can give exemption for minimum wage so that we can have some cushioning of the pains. We are not saying there is no pain. They must be paying for some reforms that will eventually give the country a breather.
Now, most state governors appear set to close the gap in the health sector exposed by the COVID-19 pandemic. Adamawa State Governor, during the foundation-laying ceremony of 2 cottage hospitals in the state, promised that a lot more is being done to uplift the sector. The governor is concerned that despite the growing population, successive administrations in the state did not consider the importance of building befitting health facilities, which has made the fight of the COVID-19 pandemic more cumbersome.
The COVID-19 pandemic has not only brought about a new normal globally, but it has swept through countries unannounced. In Nigeria, the pandemic exposed the setbacks in the health sector, which some governors like that of Adamawa State are now trying to correct. It's against this backdrop that the state is invigorating its drive towards providing adequate health care for its residents as a way of checkmating the community spread of COVID-19. Residents of Gombe and Gire turn out in their large numbers from across the local government areas to witness the foundation-laying ceremony of a new cottage hospital for them. Governor Umar Fintiri, accompanied by members of the State Executive Council, state legislators and stakeholders, performed the ceremony. A community leader from Gombe says he's appalled by the havoc wreaked on the sector by previous administrations, while the Commissioner for Health appeals for support to turn things around.
It's so terrible on health challenges. When you have a sick person, you have to go to Garkida, or you go to Hong, or you go to Yola. You can now see that you need to cover a long distance before you get to see a doctor.
The cottage hospital is a 60-bed capacity hospital with all the clinical departments inclusive.
For the governor, this may not be the right time to trade blames, but the time government should work with all citizens of the state and ensure that the primary healthcare system is revived.
My government is taking every step to ensure that our primary healthcare system is made resilient and fortified enough to address emerging challenges.
For many witnessing today's event, the expectation is to see a rapid construction work that will bring about the completion of the cottage hospital, as this is one of the ways to prove that government is not paying lip service to healthcare.
Let's talk some more about flattening the curve. We have joining us from Abuja Studios, Madam Biola Ajenifuja. She's the clinical pharmacist with Gwarinpa General Hospital. We'd like to thank you for joining us on the program.
Thank you.
The emphasis is still on prevention and adherence to the non-pharmaceutical protocols pending when we have a vaccine. But if you were to assess the pandemic curve in Nigeria, how would you describe it? I mean, what would you call it? Because some say that we are reaching a major bend in relation to flattening the curve in Nigeria.
Yes, I agree with that. We are reaching a bend. If you look at the epi curve, it has been flattened, but now it's bending. Like yesterday, we have just 90 cases, which is a good one. So which means we are reaching a major bend, and it's a plus for us.
What are your thoughts on the arguments that we're not doing as much testing as we need to, and with that, the numbers we're getting are a bit unrealistic?
And this is not just peculiar to Nigeria. It's in other places. We can't really get 100% optimum testing. But at least for now, we can make do with what we have on ground. Because let's say we are not really testing well, we should see people coming up here and there in the facilities, in the hospitals, coming down with the COVID if we are not testing, if the testing capacity is not enough. But at least we are not really seeing cases in the hospital. So the testing for now, it's still adequate. Though the figure might not be a true reflection of what we're seeing, but at least we are being able to contain the pandemic in a good way, because the death rate has reduced. Like, let me take my facility for an example. During around April, May, we do see an average of up to like 5 cases in a week. But now, I think for the past 3 weeks, we have not even seen any suspected cases of COVID-19. So even if we are not testing well, but the rate of infection has dropped drastically.
From your observation, have we started effecting infection prevention and control measures in our healthcare facilities? And this is to efficiently tackle the community transmission, and perhaps first on the part of the health workers who are to ensure that they better protect themselves and can protect others as well.
Yes, everybody is well informed. Even some of the patients are even well informed that the health practitioners, and everybody is sticking to all the preventive measures. You hardly go to any health facility without you seeing people donning on the face mask. You see the hand sanitizer and hand washing points as strategic points. And in a way, some of the facilities have learned to cope with the situation by reducing the number of staff that will be on duty at a particular time. And all those staff that are on duty are being protected by using their PPEs. And any other patient that is coming to access services in such facilities, there are rules and regulations regarding people coming in. You have to use the face mask, and you have to sanitize your hand before you come into the facility. Also, they've reduced the number of people that are coming to access healthcare. Like, before, as the Nigerian, we are a family people. You hardly see one person coming to the hospital at once. He will come with his friends or relatives or his brother and sister. But now we attend to only one person per patient. You don't see a lot of people coming into the consulting room just because of one person that is sick. It's only the sick person that will come in and will come into the consulting room, and that's the only person that the doctor will see. So in that way, we've been able to reduce out the spread of this infection between healthcare workers and even the patients.
Finally, before we let you go, different sectors are opening up in different phases, especially schools. To prevent a resurgence, what are things that we must not take for granted?
Yeah, I think we need to stick to the protocols, the way we've done with you can see when the senior secondary school students, SS3 students, did their WAEC, we didn't really record any increase in number of cases, which means the measures the schools put in place were adequate. So I think we need to stick to that, or even take it to a higher level, since we are going to be encountering more population before we can reopen the schools. Then we'll try to reduce the population. Maybe we'll have to be, it's going to be a phased sort of thing. Like maybe the JS1 to JS3 might come at a particular time in the day, while later the senior classes will come in a later time in the day. So with that, we will not be able there won't be a large population of students in the school at a particular time, so that we can try to curb this and we won't have a resurgence and we'll have to be forced to close the school down again.
All right, well, I appreciate your time. Thank you so much for joining us on the program. Mrs. Biola Jenny Fuja, clinical pharmacist, Gorimpa General Hospital. Thank you for joining us.
Thank you. The pleasure is all mine. Thank you.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. The Benue State government has cancelled the third term for primary and secondary schools for the 2019-2020 academic session due to the COVID-19 lockdown, directing schools to compute first and second term results for promotion of students to the next class. The Commissioner for Education, while briefing journalists in Makode, warns administrators of both public and private schools against charging parents for third-term fees for non-exit classes of JSS 1 and 2, SS1 and 2, respectively. Full academic activities for the 2020-2021 session is to commence September the 21st, 2020.
Third term is cancelled in the case of other students, especially students in JSS 1 and 2, and then students in SS 1 and 2. But so in this case, parents are not supposed to pay school fees for those classes. But for JSS 3 and SS 3, they have performed their third term, so their fee will be paid. I also want to say that when people resume, they will be resuming for the first term. And because some people were not able to complete the third term, the exam result for term 1 and term 2 will be used as a yardstick to promote students to the next class.
Dr. Jamiu Ganiu is a public health physician. He joins us via Skype from Bagada in Lagos. Thank you for joining us on the program.
Thank you very much for being with you.
All right, the Presidential Task Force on COVID-19 said that international travelers from some countries have been presenting fake PCR results on their COVID-19 status to enter Nigeria. That is a big risk, especially to our fight against the pandemic. Can we afford to gain some or lose some at the port of entry into the country? Or how do you see us safeguarding the process?
Thank you very much for the question. I think what we are witnessing now, it is actually expected in the sense that there is no uniformity in the testing globally. In Nigeria, our gold standard is PCR. But when you look at US, there are different kind of testing protocols, where some are using the gene sequencing, that's the PCR. In some places, they are using antibody testing. And even when you look at in UK, it's also the same. So it is expected because you cannot guarantee the sensitivity of some of those test results as compared to the PCR. So are we looking at that? I think in order to avoid a second wave of community transmission in this country, I will advise that irrespective of whatever the test result any coming passenger is presenting in this country, we should continue with the initial protocol of ensuring that those people self-isolate and at the same time are subjected to our in-country testing, which are look more reliable to us. And I think in so doing, you may indirectly able to kind of reduce some of this risk. If not, with what is happening now, I don't think we can actually risk what is actually happening at the moment. Thank you.
So with the adjustment of the validity period for PCR tests to be presented before boarding from 7 to 4 days, don't you think that will have some significant impact?
But my worry is that all the passengers actually, conducting the PCR test, that is the issue. Because as I've said, there is no uniformity in the kind of testing. PCR, you don't know what kind of testing some people have, subjected to themselves to before presenting into the country. So since there is no uniformity, I think for us to be on the safe side, we should stick to the previous protocol and ensuring that irrespective of whatever test somebody is, has subjected he or herself to in another country, such person should undergo our own test. I think that may indirectly help in solving some of this situation, because irrespective of whatever collaboration Nigeria is able to have with those other countries, we are talking about 13 countries, on which they said 9, they are having problem with about 9 countries. And imagine, how can you have in the whole aircraft, about 40% who brought a PCR test of being negative eventually become positive when their tests they were retested in this country. I think at this time, I think we should not, take chances. We need to be proactive, and I will advise reducing the 4 days to 7. The 7 days to 4 days. For me, I think is not enough. The best thing so that we can guarantee and be well assured is to ensure that at least we continue our own testing here. But my only concern is that we need to reduce the price of that testing. 75,000 is at higher price. It can discourage people. Let's try to bring the price of the test, the PCR test in the country. Let's try to bring it down so that people can afford it. I think by so doing, we can, achieve something meaningful and prevent a second wave of community transmission in the country.
And there's also a lot of risk for those traveling. But we'd like to thank you so much, Dr. Jamiu Ganeo, public health physician. Thank you for talking to us at this time.
Thank you very much.
Scientists from Uganda's Makerere University and the National Army have launched a study to find out whether plasma from recovered coronavirus patients has an effect on those having the virus. It's the country's first COVID-19 convalescent plasma study, and researchers say that there is emerging evidence to support the use of plasma for the treatment of COVID-19, especially among severe cases. Here's the global update.
Massive nucleic testing by China extends to Hong Kong. Nearly 600 Chinese health professionals have arrived in the administrative region to support its fight against the coronavirus and to support the massive testing program in particular. The testing program involves some 1.7 million residents in total.
89% of those who have tests get
Prime Minister Boris Johnson says the country's record on COVID-19 testing compares well with other European countries and that the government is working hard to turn them around even more quickly. Meanwhile, hundreds of people queuing to get a COVID-19 test in Southend-on-Sea in eastern England have been growing impatient over bottleneck in the country's coronavirus testing system. The government has promised to do whatever it takes to boost laboratory capacity that has left people across the land with no way to get a COVID-19 test. Authorities in Peru have reported that coronavirus cases are stabilizing in the Andean country, with some regions exhibiting a downward trend after months of lockdown. Peru has recorded nearly 740,000 cases of the coronavirus, the fifth highest caseload in the world, and 30,927 deaths as of Tuesday. It is tracked amongst the world's deadliest infertility rate per capita, with 94 deaths per 100,000 residents. And as a second wave of coronavirus sweeps across France and the number of seriously ill patients climbs higher, intensive care medics say the lessons learned from early in the pandemic are leading to changes in how they treat the sick. Intensive care unit Dr. Alexander Avenel says he and his colleagues are delaying mechanical ventilation, a procedure which involves running a tube down a person's windpipe, increasingly placing non-sedated patients on their fronts and reducing the doses used in corticotherapy. Young people, especially the young ethnic minorities, are more vulnerable to COVID-19, which is wreaking havoc in the United States, according to the latest tally by the U.S. Centers for Disease Control and Prevention. The latest Morbidity and Mortality Weekly report, released by the CDC, young ethnic minorities are more vulnerable when facing the virus. Finally, in Spain, the Madrid region, one of the worst hit in the country, is to introduce targeted lockdowns and other restrictions on movement on Friday in areas with high COVID-19 cases. Madrid accounts for around 1/3 of active coronavirus cases in Spain, with a higher incidence in high-density and low-income neighborhoods, mainly in the south of the city.
For more updates, you can take a closer look at our website. It's channelstv.com. Log on and you can find that story, more on the pandemic and several other stories as well. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.